Trend has been engaged by STMA to support them to develop a strategic plan that would champion the wash improvement activities in low-income communities in STMA, and also prepare behavior change communication strategy, and then also develop monitoring evaluation framework that will all support the implementation of what STMA is doing under the co-wash partnership.
As in the OGP, we believe in collaboration. We believe in broader stakeholder consultation so that we can all generate solutions that transcend us, that are more transformational. That is why we felt that we should involve other stakeholders who will, one way or the other, play a critical role in the implementation of this particular project.
To be able to do that, we had to start by engaging stakeholders at the STMA level. Already STMA has this group of stakeholders they call the Multi-Stakeholder Forum. So we engage them to debrief them on the assignment, discuss with them what their inputs are.
Access to sanitation is crucial because defecating is a natural occurrence, and whether you provide or you don't provide, the substance will come out and the person will find where to place it. So this is crucial and it's inevitable. So whoever, wherever, regardless of their status, needs to have access to sanitation. But what is the responsibility of the STMA? Are their responsibility just towards rich neighborhoods? Are their responsibility just towards communities who can afford? Are their responsibility just towards adults? So what is the responsibility of STMA? It's for everybody. Everybody in the city, STMA is responsible for the person. So that's one function that we talk about. And that relates to your OGP commitment as well and the tenets that you live by.
Beyond that, we visited 21 low-income communities. And within each community, we engage the assembly member, we engage the community leaders, we engage youth groups, and then we also engage women.
So today we are at Mimpiasem community, meeting with a group of youth and then also artisans who reside in the community. We are picking their views on the water and sanitation situation in the community and thinking through how some of these problems can be resolved. So this session is basically to pick up their views, and those will be factored into the sanitation strategic planning process.
We only have one public toilet facility, and it is not even in a good condition. And it is really giving us a whole lot of issues concerning open defecation, because now the accessing of the area is not as it used to be. So people will wish to do it in the open, which of course will not help the sanitation standards of the community. Two, we have water issues. Though the community enjoys this what you call water waste flow, but it comes and it goes and it doesn't even come back again. Sometimes they have to carry their bucket to a very long distance to fetch water to use in their homes. So our expectation as a community is that it shouldn't be a one-day wonder. The data that will be collected will be sent to the appropriate quarters, and an immediate attention will be given to the community so that all these issues that I've made mention of can be dealt with and dealt with.
Where there were people with disabilities, we also looked for them and engaged them through focus group and interviews to understand what their appreciation of their work situation is, what problems they have, what successes they have, and then how ready they are to see to improvement into their situation.
So am I getting say, I don't know, you are so organized, say, self-management. Yes.
Our engagement with them was to understand how they are experiencing WASH, within their communities. What are the sources, what are the facilities, what are the costs that they bear, what are the conditions, their level of satisfaction, what improvements they expect. Once we collected the data, we engaged the multi-stakeholder platform again to share the results that we have for them to also validate based on the work that they also do.
In the past 2 days, we have undertaken this stakeholder engagement workshop to provide the stakeholders with feedback from the field. These stakeholders are a group of people who are made up from technical officers from the STMA, civil society group. We have partners from other organizations like the Ghana Water Company Limited. As part of that, we are now into today's workshop where we are doing the strategic vision formulation and strategic objective formulation. So currently, the group work they are doing, they are trying to come up with some strategic visions that will provide the forward-looking, futuristic impression of how we want STMA to look like when it comes to water and sanitation.
We also conducted capacity needs assessment of critical stakeholders to understand what their capacity gaps are, even for the initial stages of implementation of the strategic plan. Based on the results, and we organized training for these stakeholders. The community level stakeholders, basically assembly members and traditional authorities, in one training for 3 days, and then also implementers at the STMA office for another institutions for another 3 days.
Sketch anything any animal you think that you are likened to, your character by character.
Many of the participants don't understand that assembly is supposed to work as a system. So they see themselves as just individuals working, but hardly connecting to what the STMA is supposed to do. And also the need to network, to work more as teams, because someone's input becomes another person's output. And there is a need for them to work looking at each other in cooperation. So building that capacity to change the attitude and increase their knowledge on how to implement the WASH was very critical. It came out very clearly.
With this co-WASH program, I can see the coming together of all the relevant stakeholders that are concerned in the solution of WASH problems in the community.
What I've decided, I'm going to gather my community people and see how best with a small help you can do to assist the community or even the authority.
In the strategic plan, waste collection, disposal and all those things should be factored in it so that plans will be taken as to how to tackle those issues.
As a journalist working in this metropolis and observing things over the years, I think this project is very key in solving the sanitation problems in our metropolis.
Once we did that, the information that we gathered, we put all of them together and did a draft of the policy.
The goal is that the health status is improved within the communities we are working, and this will be achieved through promotion of safe sanitation access at the household level and also at the institutional level. So you see, we've taken a bit away, we move a bit away from public toilets, and we'll look at it into detail.
The presentation of the draft strategic plan, the 6-year strategic plan by Trent, the consultant who has led the process over the past 4 months, marks a very significant milestones in the development of this plan, as all the stakeholders that matters were here today to validate the draft plan?
As a community development officer, I have recorded a number of cases where some communities are not having toilet facilities, potable water facilities. So most of them are engaged in the open defecation. That has environmental problem, and it puts their health into a form of danger. So this strategy rightly addresses that issue.
For me, on the strategies that has been presented, it will help in waste management in Takoradi within those vulnerable communities, because there is an involvement of informal sector waste collectors, and these waste collectors will actually go into the communities, the indigenous communities, to be able to pick the waste within those houses that the formal collectors are unable to access because of road accessibility and those kind of things. So the strategies as has been presented will go a long way by 2030 to be able to clear up all the waste that are uncollected within the metropolis in those communities. And it's a good strategy that we need to implement very well.
One critical activity that would trigger the implementation of the strategic plan is to set up a strategic plan implementation team who would also be trained and be at the forefront of implementation of the plan, acting on behalf of STMA to really ensure that all actors are playing their role.
For me, sitting back and listening to the presentation that was delivered by the consultant Trent and the appreciation of the stakeholders gathered here, a lot of work has been done throughout the co-creation process for this 6-year strategic plan for WASH for Sekondi Takoradi Metropolitan Assembly. So for me, I think we have met our target, or you have met our objective for co-creating this strategic plan for the Sekondi Takoradi Metropolitan Assembly, and I think it is going to go a long way for us in the metropolis to address the water and sanitation challenges that we are facing, most particularly in the low-income communities within the metropolis.